Hey Oklahomans, Kevin Stitt here. I want to take a moment to speak directly to all 4 million Oklahomans and update you on the steps we are continuing to take as we mitigate the spread of COVID-19. As a reminder, all 77 counties are under a safer at home order. That means anyone 65 and older or with compromised immune systems need to stay at home until April 30th. We know that our number of COVID-19 cases will continue to rise as we increase testing and as the virus continues to spread. That's why it's so critical that we all practice social distancing, avoid groups of 10 or more, and continue to wash our hands frequently. In accordance with the latest guidance from the CDC, I issued an executive order requiring anyone entering the state of Oklahoma from New York, New Jersey, Connecticut, California, Louisiana, or the state of Washington to self-quarantine for 14 days in order to reduce the transmission from known hotspots in our country. To protect our most vulnerable populations, I'm requiring all delivery personnel to submit to screening if requested at hospitals, clinics, long-term care facilities, and daycares before entering the buildings. This screening likely would include a temperature check and a short questionnaire about their potential exposure to COVID-19. Because we know how important our frontline healthcare workers are in this fight, I issued an executive order today protecting healthcare workers and their children from discrimination or exclusion in housing or childcare services. We are also working with experts from the Oklahoma State Department of Health and our state's research universities to model how this virus will impact our hospital capacity. I've authorized FEMA to start the process of working with the Corps of Engineers to start looking at 10 sites across our state that could be converted into alternative care facilities should we need them. I've also been working with the Oklahoma Hospital Association to make sure each of our hospitals has a plan in place to increase the number of ICU beds they have available by at least 40%. I've also suspended some regulations on reserve law enforcement officers and officers who are in training so they can help serve our rural communities in the field if this virus causes shortages. Oklahomans, please take this seriously. I know this virus is affecting all of us in different ways. Some of us, it's affecting our health or the health of our friends and loved ones. For others, it's our finances. And for all of us, it's greatly affecting our way of life. Taking strong steps now is important to getting back to normal as soon as possible. Thank you. God bless you, Oklahoma. We're going to get through this together.